Welcome everyone to the Hemophilia Council of California. This is our first webinar of the year. I'm Lynne Kinst. I'm the Executive Director of the Council, and tonight we are going to be talking about the state of healthcare in California. Give everyone an introduction to kind of where things stand. So with that, I want to just get started. And as we are kicking off the year, we wanted to do a better job, especially for those who might be newer to the council, to remind everyone who we are. So what is the Hemophilia Council of California? We were founded in 1982 by the 4 California Bleeding Disorders organizations and incorporated in 1989. Initially, a lot of the work that the council did was in response to HIV contaminated clotting factor, and in fact, we had grants from the state of California that helped provide mental health services to the community. But since that time, we have continued to adapt into a patient advocacy organization that coordinates statewide access, education, and advocacy efforts in cooperation with the 4 California Bleeding Disorders organizations. We advocate to protect access to care, to promote progressive treatment options, and to advance the quality of life for individuals, families, and caregivers living with hemophilia, von Willebrand's, and other bleeding disorders. Our mission is to improve access to care and treatment options in order to advance the quality of life for people with bleeding disorders. And our vision is open access to quality and innovative care and choice of treatments for all people with bleeding disorders. So that's just a little bit about the role that the council plays. You'll notice we are transitioning this year, and we're moving our webinar series to the evenings. We hope that that will allow more community members to be able to join and learn the things that we are presenting during our webinar series. But you'll notice that our webinars, we try to be a little bit unique and different from what you'll get from your local bleeding disorders organizations, and really focus on advocacy and also access. So we focus on how do you access your healthcare? What are the challenges that you're going to face from your insurance, or if you're using Medi-Cal or CCS or GHBP, and those are terms that we'll talk about a little bit more as we go through our presentation tonight. So if you're like me, you probably have some COVID fatigue and you probably have some Zoom fatigue, but we're thankful that you're here joining us tonight, and we aren't going to focus on those issues. Even though there continues to be obviously strain and challenges related to those things, we have found that in these times advocacy is even more important than ever, which is why we've continued to present these webinars in a virtual format. And frankly, just with the geography of California, it's a much more practical way to try to get this information to as many community members as possible, regardless of some of the pandemic restrictions. So we will continue to advocate to improve the quality of care and treatment options. And we have some good news that we're going to share with you tonight. Terry's, stealing Terry's thunder a little bit here, but California's newly proposed state budget has a significant surplus, and at this point the proposed budget fully funds programs like GHBP, the Genetically Handicapped Persons Program, and CCS, California Children's Services, which are critical support services for our community. So with that, I'm going to introduce Terri Cowger-Hill. She's the principal with Cowger and Associates, is a health policy expert, and has been the legislative advocate for the Hemophilia Council for about 28 years or so at this point. And so we appreciate Terri's expertise, the passion that she brings. She and I are often on the texting even in the evenings and sometimes on the weekends, helping to resolve issues. So we appreciate all that she brings to our community, and she's going to share with us some more about what is coming up for California. So Terri, why don't you take it away?
Thank you, Lynn, for that warm introduction. It's my pleasure to have been with the council for so many years and to continue during this exciting time. So, as Lynn mentioned, we do have good news, even though we're in the midst of the Omicron tail end of the COVID-19 pandemic. So, as she mentioned, we have a projected total surplus in California of $45.7 billion with a B. So every year, the council works on the state budget process, as well as the traditional legislative process where we follow bills that get introduced in California. So the good news is we have this enormous total surplus. We also have 34.6 billion in reserves, and those reserves are for economic uncertainties. So what is Governor Newsom proposing to spend with that surplus and with that additional funding? So first of all, he's proposing in his newly introduced state budget to focus upon the following key priorities for 2022. These priorities are just his wish list, and they will be debated in the upcoming legislative subcommittee hearings. So first of all, as Lynn mentioned, there's funding for COVID-19, the pandemic, as well as additional funding for healthcare. There's also funding being proposed for children and behavioral health proposals, for addressing climate change, the various fires from the droughts that California has been facing. There's also generally in the budget about 50% automatically goes to education through K through 14. And that's because of Prop 98, which sets in place per the voters where some of these revenues need to go. And education has earmarked dollars per Prop 98. There's also additional funding for public safety. You might have heard during the holidays, there were several store break-ins. And so the governor's proposing to put money into that to help protect the public safety, as well as some of the crimes that have been taking place in retail establishments. There's also funding proposed for housing and homelessness. And again, a strong economic reserve so that if we start to run short in key programs, there'll be money there to address some of those issues, such as the fires and public safety issues. So next slide. So specific details in the budget. The governor is putting $2.7 billion into COVID-19 pandemic relief. What he's looking to do is spend more money on testing, vaccines, frontline workers, vulnerable populations, and contact tracing efforts. You might want to screenshot that link that's at the bottom of this slide. We will provide the slides later as well as a recording, but that particular link is where you can go to see more details right off the bat on this $2.7 billion COVID relief response package. So it is exciting, even though, as I said, we're still in the midst of this pandemic, but hopefully we're at the tail end of it. And because of the huge surplus, we have quite a few things in the healthcare arena that the governor is proposing to focus upon. So in healthcare and Medi-Cal, the first bullet point is really exciting from the council's perspective, and our advocacy committee just reviewed this and will be recommending full support when our board meets next. And that is the governor is proposing to expand Medi-Cal full scope eligibility to all income eligible adults ages 26 to 49, regardless of their immigration status. You might recall in recent state budget years, the governor has expanded Medi-Cal full scope coverage for the undocumented, and he started with children and then he did the elderly, and so now this would pick up the remaining of those who don't receive full scope Medi-Cal eligibility regardless of their immigration status. So again, this will be a proposal that will go through the committee process, the budget subcommittee process, and the council is recommending, or the advocacy committee is recommending, a support position on this. The governor is also looking to establish an Office of Healthcare Affordability. He's got a new proposal to reduce the cost of insulin, perhaps by contracting with drug companies. He's got a proposal to expand behavioral health and the crisis care continuum. He's got a proposal to address the opioid crisis. and support the aging population by coming up with a new master plan for aging and reforming the nursing facility financing, as well as expanding Alzheimer's Healthy Brain Initiative. You might have heard about CalAIM, and we'll talk a little bit more about that later in this presentation, but the governor, it does have full funding in the budget for CalAIM, or whole person care, under Medi-Cal managed care. He's also looking to eliminate some of the provider cuts that were proposed in previous budget cycles, and more money for childhood trauma, or ACEs screening. He's also proposing to reduce the Medi-Cal premium that certain patients have to pay in the Medi-Cal program, and he's focusing upon reducing those premiums for pregnant women, children, the disabled, and the disabled working adults. He's also got a proposal to extend dental managed care contracts as well.
We do want to thank our webinar series sponsors, Sanofi Genzyme and CSL Behring. And I know that there will be others added to that as the year progresses. Thank you all for coming, and we look forward to a great year. We would just ask, keep an eye on your emails. Don't hit delete without reading it when you see something come in from the council, because we will definitely be letting you know when there are urgent public policy issues for you to weigh in on that are going to affect the bleeding disorders community. So we appreciate your partnership in that. All right. Thanks, everybody. We'll have a great evening, and we will see you soon. Good night.
Bye, everyone.